Good morning. My name is Shreya and I'll be your examiner for today. I'll be performing the Leopold's maneuver. Can I know your name and age?
Should be 25 years.
Okay, we'll be performing this test to detect the fetal lie, presentation, fetal heart tones, etc. So is that okay with you?
Yes.
Okay, we'll be starting now. Now I'll be performing the Leopold's maneuver 1, LM1 or the fundal grip. This is used to determine which part of the fetus actually occupies the fundus, the buttocks or the head. For our patient, it's the buttocks. So the LM1 will be cephalic, and for this maneuver, I'll be facing the upper body of my patient. Now, we'll be performing LM2 or the umbilical grip. I'll be checking the size of the uterus of my patient to locate the fetal back. Fetal back will feel resistant and convex, whereas the other body parts will seem like angular nodules. The fetal back is important to locate so that we can auscultate the heart sounds because they are best heard at the fetal back. For this patient, the fetal back is on the maternal left, and now we can auscultate the heart tones using the stethoscope. Now I'll be performing Leopold's maneuver 3, LM3 or the Paulick's grip. For this also I'll be facing the upper body of my patient. I'll use the thumb and the fingers and place it above the symphysis pubis, and this is used to determine which fetal part will be presenting. The head will feel as a firm, hard and palatable mass. And if the head is engaged, it will not move. If it's not engaged, it will be movable. Now I'll be performing Leopold's maneuver 4, LM4 or the pelvic grip. This is used to check fetal attitude and the degrees of flexion or extension. If the fetal head is at the same side as the back, it is extended, and if it is as in the same side as the other body parts, it is well flexed. And if my hands converge, then the head is not engaged. If my hands diverge, then the head is engaged. Good morning, my name is Shreya and I'll be your examiner for today. I'll be doing the breast examination. Can I know your name and age?
Should be 25 years old.
I'll be doing it in 3 steps: general inspection, palpation and general inspection of the lymph nodes. Is that okay with you?
Yes.
Okay. You have to undress yourself up to the waist. You can go and change in the dressing room. We'll be starting with general inspection. For the first step, I'll ask my patient to sit upright, relaxed with her hands kept on the thigh, and then I'll check for any nipple discharge, swelling, asymmetry or scars. For the second step, I'll ask my patient to keep her hands on the hips and push inwards to tense the pectoralis muscle. If a mass is present and moves with the pectoralis muscle, it suggests a malignancy. This is called death ring. Now, for the third step, I'll ask my patient to keep her hands upright or keep her hands behind the head and check for any deformities, scars, nipple discharge or scars. And then for the final step, I'll ask my patient to lean forward and repeat the general inspection. Now, I'll ask my patient to lie flat and keep her hands behind the head, and I'll ensure my hands are warm before touching the patient. Then, I'll squeeze the nipple gently. If any discharge is present, I'll note the color, odor, consistency and amount of discharge. Now, for the palpation of the breast tissue, I'll be using the spiral method. I'll ensure that my hands are warm and I'll check the asymptomatic breast first. I'll use the finger pad of my 3 fingers and press downwards to the chest wall in circular motion to check for any masses. If a mass is present, I'll note the size, shape, position, fluctuance, mobility and overlying skin changes. I'll check up to 3 levels: superficial, medium and deep. Now we'll palpate the axilla, medial, posterior, lateral, anterior and the apex of the axilla. Now we'll perform the general inspection of the lymph nodes. I'll start with the cervical, supraclavicular, infraclavicular and the parasternal lymph nodes. Now we are done with the examination. We'll explain the findings to the patients, and that's it. Thank you.